Welcome to the Foresight Health Roundup podcast, Foresight Health's podcast series for healthcare revolutionaries. Outcomes matter, customers count, and value rules. Hello again, everyone. This is Dave Burda, news editor at Foresight Health. It is Thursday, February 20th. We're going to get right to our topic today, as I don't feel very humorous with the new administration gutting our federal health agencies. Hope you didn't need that ACA navigator to find a health plan. But we do have Dave Johnson, founder and CEO of Foresight Health, and Julie Murchinson, partner at Transformation Capital, to help us navigate through some of the big healthcare artificial intelligence news last week. Hi, Dave. Hi, Julie. How you two doing this morning? Dave?
Usually by this time of year, Dave, mid to late February, I feel like we've kicked winter in the ass. This week, however, Mother Nature's been the one doing the ass kicking. I've spent most of this week in Minnesota with wind chill temperatures in the minus 20 to 30 range. My wife, Terry's started calling all this new weather global weirdness instead of global warming. I think she's onto something.
For sure.
It will catch on. That's great. Julie, how are you?
I'm well. I'm in Boston where it is also nippy, but not like where Dave is. And I'm just really happy that I didn't try to go to 5, where Nashville is effectively shut down with 5 inches of snow. Sounded like a nightmare.
Yeah, that'll cripple Music City, that's for sure. I can only imagine. Let's talk about what cuts at various federal health agencies shocked you the most. Dave, what made you say, you've got to be kidding me?
Well, maybe not the most surprising given how nationalist the Trump administration's agenda is. But for me, the saddest was the virtual elimination of USAID. As a former Peace Corps volunteer, I've been very aware for decades of all of the great work done by the USAID professionals, particularly in the areas of public health and fighting AIDS. For most of the last century, the U.S. has been a compassionate world leader. That appears to be ending. I hope the Peace Corps isn't next on the list.
Yeah. Compassion's not a word you hear recently. Julie, what cuts are bothering you the most?
I mean, there are so many. I'm still struggling with the impact on health centers because of the extraordinarily important role they play in the community and how just like the simplicity of must cuts can cause such widespread, risk to sustainability of healthcare. It's crazy. But for me, the most disturbing, honestly, is the CDC's program that embeds recent public health grads in local public health departments. And I mean, why are we cutting development like that? We need that for long-term development and growth. We need the new blood. So it's hard to grasp it all.
Right. Wiping out the next generation of epidemiologists. For me, it was gutting the CDC's epidemic intelligence services. These are the disease investigators on the front lines of public health emergencies. They rush into a hot spot to figure out what's going on so they can save the rest of us. So, it's bleach and light bulbs from now on, right? 2 more things I have to stack up on, right, Dave?
Yeah, ignorance is bliss.
Yeah, that's in addition to water, rice, and aluminum foil. So now I'm up to 5 things. Okay, I'm going to ask you what light bulbs went on when you read some of the big news in healthcare AI last week. The first is a survey of about 1,200 physicians by the American Medical Association on their views of AI. The second is a survey of about 2,000 U.S. adults by researchers at the University of Minnesota on patients' trust in health systems to use AI the right way. Go Gophers. Let me give you the top line findings of each, and you tell me what they mean for AI and healthcare moving forward. Here goes. 66% of the physicians surveyed by the AMA said they currently use one or more of the 15 AI use cases cited in the survey. That's 2/3 based on my grade school math. That's up from 38% in 2023 when the AMA did a similar survey. The 3 top use cases cited by the physicians were documentation of billing codes, medical charts, or visit notes, automation of insurance pre-authorization, translation services, and generation of chart summaries tied for 3rd. The least popular use cases were analysis of patient-generated wearable and remote patient monitoring device data, prediction of demand and associated workforce needs, and surgical simulations and guidance. 68% there was an advantage to using AI in patient care, and that's up from 63% in 2023. Now, let me tell you what consumers think. This survey was published in JAMA Network Open. The survey asked patients whether they trust their health systems to use AI responsibly and that an AI tool wouldn't harm them. They measured trust on a 4-point scale, with 1 being those statements were not true, to 4 being those statements were very true. 65.8% of the patients said they didn't trust their health system to use AI responsibly, and 57.7% said they didn't trust their health system to make sure an AI tool didn't harm them. Again, using my grade school math, that's nearly 2/3 and more than half, respectively. Dave, what's your reaction to what these surveys found? Did any other results jump out at you, and why? And what do they say about AI in healthcare moving forward?
Isn't it remarkable how many of healthcare's challenges, sort of regardless of what the topic, really come down to trust and whether consumers believe their caregivers and the systems employing them are acting in their best interests? Specifically on AI, which is our topic du jour, when you look at the AMA survey, most of the AI tools physicians are getting excited about, including the top three that you mentioned, Dave, relate to reducing their administrative burdens. It's all about them, the docs, not about the patients. Yet when asked about where is the biggest potential for AI, number one was work efficiency, so that correlates with the findings. But after that, the next two were diagnostic ability and clinical outcomes. That's where they thought ultimately AI would be the most helpful. But the activities listed on the survey that related to better diagnostics and better outcomes don't crack the list of the most important use cases for doctors. I've said it before, but let me say it again. Healthcare's biggest flaw is that it doesn't see human beings at the end of its transactions. It sees a bill, it sees diagnostics, it sees treatments, it sees codes, but it doesn't see human beings. And the data in these surveys confirms this dismal reality, both from the physician's perspective, what are they focused on with AI? How do we relieve their administrative burden? Not that that's not important. It absolutely is. But come on. At the end of the day, aren't we supposed to be serving consumers? And that's why I think the scores you see from the patient's perspective are so low, so distrustful. If consumers already think the system is acting against their interest, why would new AI tools make them believe any differently? So there's a way out. It's not easy, but it's giving consumers agency. This is what Baylor Scott and White is doing. So Pete McKenna, the CEO, he's one of my favorites in the country, has identified 5 jobs to be done to fulfill the health and healthcare needs of Baylor Scott and White's customers, not consumers, customers. For them, ultimately, customer and consumer are one and the same. So here are the 5. Do not turn away customers who are knocking at our door. Number 2, get the customers to the right place every time. Number 3, amplify customer relationships by engaging them on the digital platform. Number 4, make the next connection for customers proactively and reactively. And number 5, eliminate all customer friction. My God, if we were using AI to do all those things, I think you'd see those consumer scores go through the roof. So come on, healthcare, get over yourself, deliver for your customers, make yourself relevant in the marketplace.
That is a powerful list. I had not heard that before, Dave. Thank you for sharing that. Julie, any questions for Dave?
I love that list. And Dave, as you know, Baylor Scott and White has developed a lot of their own technology platform. So I would also argue that you cannot do what Pete McKenna says in Epic alone.
Got to walk the talk, right? I mean, come on.
Yeah. So Dave, I'm curious about the governance side of this. The consumer survey showed that women were less trustful of AI in healthcare than men, and that past experiences with discrimination in healthcare were also associated with lower trust in AI-related decision-making. So what do you read into these findings as it relates to the need for governance of AI or a different way of operationalizing, or, how do we build trust here?
Exactly. Did these findings surprise you, Julie? They didn't really surprise me, but I bet they didn't surprise you either.
No.
Yeah.
No.
So if I were running a healthcare system or a healthcare executive at one of these big systems, these findings would terrify me. We know that women make the vast majority of healthcare decisions for themselves and for their families. We often talk about them as being the quote unquote family CEOs when it comes to making healthcare decisions. I really don't think it's much of a stretch to say that healthcare's trust issue is fundamentally a women's trust issue. It's time for health systems to figure this out, like Baylor Scott and White is doing, if they want to, keep their market relevance, like I was saying before. I can't say this enough, and I've already said it once this morning, but there are human beings at the receiving end of healthcare transactions. And the vast majority of those human beings, at least the ones making the decisions, are women. Serve women well, and you'll serve your company well, and you'll go on into the future swimmingly. Don't do that, good luck.
Yeah, know your customer. Julie, you said a few weeks ago on the show that every solution out there is touting AI, right? If I remember that correctly. Is the market in sync with what physicians think and what consumers think? And what do the results say about healthcare AI in 2025 and beyond?
Well, to be fair, the market's all over the board because so many founders and companies are trying to think about really wild applications of AI. But where we are today, that AMA survey shows that physicians are intrigued by the assistive role of AI, reducing administrative burdens, enhancing diagnostic accuracy, things like that. And that's consistent with what we've seen. The autonomous generation of provider notes from visits and, augmenting notes like we're seeing from a Bridge or DAX, those tools have been very enthusiastically adopted by physicians, which I believe has been a game changer for physician trust in AI. They love it. But it's really all about saving physicians time and reducing burnout, though these technologies currently don't do much more for them than that. For example, they don't integrate medical coding today, which seems like a logical capability to sweeten the ROI for both physicians and practices and health systems. So, some of these tools have really engendered some loyalty and excitement very early on, but they're still a little bit blunt. And we just partnered with a company called Rad AI that uses generative AI to automate radiology impressions and reporting, which cuts the time for radiologists on dictation, like from hours to minutes, right? So radiologists love it. And when you look at what's happening with decreasing radiologists and increasing imaging, these tools are very important, but it's adding on to them, like Rad AI starting to help health systems pull patients back in for follow-up and based on what they're seeing in imaging to make sure that they're managing the future of that patient's health. So some of these tools are starting to get really specific about how to create value in ways that are beyond the bluntness that we're seeing today. Well, these are only a few examples. It's building goodwill. So the other part, I guess, we're seeing is the patient engagement and automated patient communications and call center automation and things like that. Those are, I think, also, a lot of systems are looking at those pretty seriously. But again, it's all the back office stuff. So the survey went on to say that physicians have concerns about things like AI offering incorrect conclusions or its integration with the EHR, which is always, of course, a concern, or putting privacy at risk. And so they are really hesitant about the things where AI could be game changing on the clinical side. And that's pretty consistent with what we're seeing. There's a lot of really interesting clinical decision support approaches out there today. But at the end of the day, there's a lot of concern once you actually go from what's in the literature to how to apply it to the clinical decision in front of you and the workflow. And frankly, how AI can make a lot of the device diagnostic use even, more robust. So we're a long way from really trust in the clinical side.
Got it. Thanks, Julie. Dave, any questions for Julie?
Julie, kind of a big picture question. What is the most impressive AI application in healthcare that you've seen or experienced, and how is it rocking the healthcare world?
Oh, it's such a hard question because, I look at what Halamka is doing at Mayo, and it's incredible what they're doing by using AI and machine learning across all their data. I mean, their personalization potential is incredible. And Suchi Saria, who I think many people probably know, she's been in and around both inside the Beltway landscape, Johns Hopkins. She has a company called Bayesian that's pretty impressive, taking a very automated approach to detecting sepsis, and obviously looks to go way beyond that. There's a company that Sequoia funded called Open Evidence, however, that doesn't necessarily try to get into the workflow in ways that Bayesian or others do, but it's partnered with the New England Journal of Medicine, and it's one of the fastest growing healthcare businesses around. They have thousands of verified doctors, registering each month to just use the latest in research that's being published. So that's a very kind of physician independent use case that isn't about the health system, top downing their clinical decision support. So Dave, I mean, it's hard to answer the question because you see new things every day.
Yeah.
I think these AI docs and the AI nurses could really go a long way in terms of driving self-care, but they are just highly experimental today.
Yeah, synthesizing all the medical research out there. I mean, that's a great use case right there. Thanks, Julie. For me, reading between the lines of both surveys, physicians and patients want AI to make their lives easier and not more difficult, right? Whether it's accessing care or getting paid for services rendered. So let's see what happens. Thanks, Dave, and thanks, Julie. Let's talk about other healthcare news this week. Julie, what else happened that we should know about?
Well, this one's a little bittersweet for me, but you might have seen that Trump expanded access to in vitro fertilization. And while it makes me so happy and I'm thrilled for women everywhere, the quote from, I think this might have been from a few years ago in his first term, it's because we want more babies. Yeah. Okay. That's what we want.
Of a certain type.
Right. Exactly.
I think is easy to complete the thought, right? Dave, what other news is worth mentioning?
God, how far are we away from the Handmaid's Tale? Anyway, Dave, I've been thinking a lot about the application of physics to healthcare, and are we in a period of disequilibrium? Well, this week's edition, I'm thinking about Newton's third law of motion. Every action has an equal and opposite reaction. So here's the action. This week, the AHA issued its annual economic impact report about how hospitals support their local economies. I never know whether this is more a work of fiction or horror, but they claim that 1/6 of the U.S. economy tracks back to everything that happens at U.S. hospitals. Like, that's a good thing. Imagine if we get the same or better outcomes for less money, how many more resources we'd have to pay people better and invest in more productive industries, fund vital societal needs, that kind of thing. So that's the action. The reaction is the Indiana state legislature is working on a bill to lower hospital spending by taxing excess facility fees and, in extreme cases, taking away their state tax exemption. And this has been a focus in Indiana for a while because the RAND studies are commissioned by the state just show how out of whack hospital prices are. So action and reaction, physics applied to healthcare. Here we go.
Mm-hmm. Never thought I'd see Indiana being considered a bellwether state. So that's interesting just there. Thanks, Dave, and thanks, Julie. That is all the time we have for today. If you'd like to learn more about the topics we discussed on today's show, please visit our website at foresightshealth.com. You also can subscribe to the Roundup on Spotify, Apple Podcasts, YouTube, or wherever you listen to your favorite podcasts. Don't miss another segment of the best 20 minutes in healthcare. Thanks for listening. I'm Dave Burda for Foresight Health.